Welcome everyone. Thank you for joining us here today on our second of our online lectures as part of the CLL online public programme session. So we're expecting about 70 people to join us today, which is great news. I think you all heard about this lecture via our new CLL newsletter, which I hope you're enjoying. There's a lot of work going into it and trying to keep you all updated on what we've been doing over the last couple of months in this very different work situation that we've been in. But we've been trying to keep CLL alive and keep our classes going and keep all of you engaged with the university and Centre for Lifelong Learning. So hopefully this is one way of doing that for some of you. We're very excited to have Alexandra Mavroeidi here today with us. Alexandra was actually due to deliver one of our public lectures in person, face-to-face in May. So unfortunately, obviously that didn't happen. So this is a great way for her to still be able to do that for us. I just wanted to quickly highlight before we get started, just to remind you all about our new summer programme that starts on the 6th of July. I know many of you will have already signed up to that. Classes starting at week on Monday and run all the way until early September. So there's still a few places left if anybody's looking to get involved. We've got some spaces left in some classes. So go on to our MyCL and have a look and see if there's anything there that you fancy. But for now, what I'll do is I'll just hand over to Alexandra. So Alexandra is a senior lecturer in physical activity for health and is going to be talking to us today about bone health. So I'm just going to pass over to her now. So I'll come back on towards the end when we'll have an opportunity to ask questions. You should see on your screens that there's a Q&A little sort of chat button, so that's what we're going to use for questions. I would ask that you just wait until the end of Alexandra's lecture before asking questions, and then we'll work our way through those. So if you click on the button, you'll be able to type in and we'll both be able to see that. So as I say, if we could leave that until the end, that would be great. But for now, I'll hand over to Alexandra. Thank you.
That's great. Thank you very much, Gemma. Thank you very much, and a warm welcome from me as well. This is strange times just now, so I'm doing this webinar looking at my screen somewhere on my landing in my house rather than being in front of you and communicating with you in more face-to-face, but we'll cope. As Gemma said, I am a senior lecturer at the University of Strathclyde. I am known as the Bones Lady in my group because I do research in bone health. I'm also known as the Older People's Lady because the demographic that I research is older adults. So that's kind of my background. So what I thought we'll do, before we kind of start our session, just a little bit of housekeeping. As Gemma said, this is a webinar that's been recorded, and we'll send you the link to this one after the event is complete. We will share the slides, so there's no point of you frantically writing and scribbling down, because I'll give you my slides at the end of this session. And I'm more than happy to take any questions or any comments that you might have at the end of the session. It's a little bit strange delivering kind of an interactive session through, you know, a webinar without me being able to even see you, but we'll go, we'll get there. So what I was going to start with is what is life in your years, and you know, this whole presentation is about older adults, and in my mind, older adults are people who would be in their 50s and in their 60s. It's defined older adults, people over the age of 65, but in my presentation, I will include people slightly kind of younger as well. But what we know that life in the over 50s, if you want, years requires more than just stamina and energy. It requires a lot of strength and balance in order for people to feel confident to do all the activities they would like to do. And therefore, the motto of this kind of presentation is that it's never too late for you to do something in order to improve your strength and balance, and therefore improve your quality of life, being able to do and enjoy do things in everyday life. Of course, everyone is different. Our strength and balance ability changes over the life course. it diminishes as age increases, as you can see from this graphic here. So as age increases, there's a natural decline in both our strength and balance ability. And that decline could be accelerated, or the trajectory of that decline might change based on certain events that might happen, or diseases that we might get throughout life effectively. But what happens is that when we are early in life, there is kind of an exponential growth, if you want, of your strength and balance. It plateaus during adult life, and then it diminishes in older life over the age of kind of 60, if you want. But what happens also as well is that not everyone is the same. So you can have older people here at the end or kind of the spectrums of very different abilities, functional abilities. So you can have people who can still in their 60s and their 70s run the marathon, but you can have other people who are not able to kind of stand without aid from sitting from a chair. So we're all very different. There's a very different trajectory for all of us of decline in our ability and functional ability and strength and balance. And this kind of this presentation is going to try and kind of look at this whole spectrum of abilities, but do bear in mind that one shoe does not fit all. So these are the things that I thought we could cover during the session. We can talk about exercise and why it's important, and perhaps concentrate a little bit more on inactivity and sedentary behavior. That is my area of expertise and my area of research expertise. Look at the Chief Medical Officer's physical activity guidelines for older adults. I was fortunate enough to be involved in the latest guidelines, or the revision of the guidelines in the 2019 publication. And I think I would, I would like us to also cover a little bit on what you can do in the situation that we are currently in the COVID-19 era, what is possible as far as exercise is concerned, and probably show you a couple of initiatives that are currently happening in order to keep older adults physically active while we are in under these strange kind of circumstances. So I'm interested in bone health and the effect of exercise and sedentary behavior in bone health. Why? Because osteoporosis, which is a disease of the bones, is a very, very prominent disease in Western societies. So if we were doing this live, I would ask you to raise hands if you yourself have got osteoporosis, or if you know of someone who's got osteoporosis. And normally, quite a few hands will go up kind of in a lecture if we were in a theatre. It is a very common disease. It's a disease that leads to fragile bones, and these fragile bones can cause painful and debilitating and sometimes fatal fractures. It's also known as the silent disease. Why? Because you don't often know that you've got the disease up until you had a minor slip or a minor fall on an icy pavement on a winter's day that you were going out to the shops, and from that minor fall you actually fell down and you broke your hip. 1 in 2 women and 1 in 5 men over the age of 50 will at some point during their life experience a fracture, bone that is fractured because of poor bone health. So it is a very prevalent disease. Indeed, we've been talking here for 10 minutes or so. So every 2 minutes you get one person who one bone broken. So we've been talking for 10 minutes. So about 5 broken bones have already occurred while we've been having this kind of seminar. The cost to the individual and in the NHS is very high. So there is a very high kind of price to pay if you have this disease as a person, but also there's a high price tag for the NHS to treat fractures, especially hip fractures. And I would like us to concentrate a little bit on the personal costs and see some things that people with osteoporosis have told us. So this is kind of Joyce's story. This features on the Royal Osteoporosis Society website. I do a lot of them, just telling us her story on how the quality of her life has changed throughout her diagnosis. So when she was first diagnosed and she first had her first fracture, she probably didn't alter her normal activities. She used to love to dance, she continued dancing, but as it often is the case, when a second fracture occurred, that really knocked back her confidence, and she really changed the way that she behaved. She stopped dancing, she stopped having that kind of confidence of going out and about, and that's quite an important kind of aspect of the whole kind of osteoporosis and the effects that might have on the individual and the quality of life that you might have after you have had a fracture. Men equally report kind of strong adverse effects after having been diagnosed with osteoporosis or after having had a fragility fracture. Here are some testimonials from some men who've got osteoporosis, and there seems to be a frustration that people cannot do anymore what they were able before to do. There seems to be a feeling of being ashamed that they're not able to contribute as much as they would have done before, because they're worried that if they do their normal activities and if they help their wives carry the suitcases when they're traveling, that that might have an effect on their bones and they might break a bone, or they feel kind of inadequate because they cannot do any heavy lifting anymore, and that's what men normally do. So there's a lot of kind of psychological effect as well as physical effect of the disease or to the people who actually might be suffering from osteoporosis. And quite a lot of that psychological effect is guided by an increased fear of falling on people who have osteoporosis. And it's a vicious cycle because the fear restricts the person to do the normal things that they would do, to be as active as they used to be before they had osteoporosis, which in turn leads to a deterioration in the physical functioning. And if you have lower ability of doing things, then as a result, you decrease your physical activity, both indoors and outdoors. And if you decrease your physical activity, then that leads to further functional decline. And that functional decline then could lead to increased risk of fractures. So it's a vicious cycle, which is quite difficult to break. So I've painted quite a bleak kind of, if you want, a picture for people who have osteoporosis, and how they might be feeling. But there are things that they can do to help themselves with their disease. And I will try and advocate during this presentation that being less sedentary and more physically active, that is one way of actually breaking that cycle and actually improving your disease outcome. Of course, as we get older, there is a natural decline in your bone mass. We all are going to lose some of our peak bone mass by the age we get into our 70s and 80s and 90s. So this is what normally happens as age increases. Within the first 20 years of our lives, we have an exponential growth. That's the best years for building up bone and building up your skeleton, up until you reach your peak bone mass in your mid-20s. And then after that, you get a period of time during your early adulthood where your peak bone mass will remain at a plateau. And then around the age of 45 to 50, 55, there is a natural decline that starts occurring for both men and women, a much more pronounced decline for women due to the onset of menopause in about 55 to 65 years, and at the age of 55 or 65 years. So we normally lose some bone. The question is that how can we minimize how much we lose? So therefore that decline is so bad that it gets us into the osteoporotic range. Oops. So this is what your bones look like under the microscope if you have a normal bone on the left-hand side or an osteoporotic bone on your right-hand side of the screen. A normal bone will have much more mass, so there is more bone there than an osteoporotic bone, but also will have a better microarchitecture. It will have a better quality, if you want, of the bone. So I hope you can see that in the picture. So when I give talks to people, I normally say to them that normal bones are like a crunchy bar, strong, difficult to break. Osteoporotic bones are like Maltesers, easy to squash if you apply some force to it. So we want you to be a crunchy and not a Malteser. So what can you do to achieve that, and what can you do to stop the progression from a crunchy to a Malteser? Well, there are certain things that you can't change. You can't change your genes and you can't change your hormones. You can't change who your mom and dad are. And there's a very strong genetic component in the influence on bone health. About 75 to 85% of your bone mass is inherited. But there's not much we can do about that. There's also very little you can do about, your hormones. The fact that, some of you might be going through the menopause or have gone through the menopause, which is a natural state, but has an effect on these hormones called estrogens, who also has also in turn have got an effect on your bones. However, there is something you can do about lifestyle. There's something you can do about your nutrition and your physical activity. And for this presentation, I'm going to be concentrating on your physical activity. So there are modifiable risk factors for bone health. Some are non-modifiable, your genes and your hormones, but others you can do something about. We know that physical activity is actually a very important risk factor for osteoporosis. And we know this from studies like this one that you can see here, from studies of complete immobilization. This one that I'm presenting to you here is 12 weeks of people lying in a bed and measuring, how much bone they lost. They can lose 3 to 5% of the total bone and mineral density, which that, if you think about it, equates to about 10 years of normal aging bone loss. So lie in a bed for 3 months, and that is equal to 10 years of normal aging bone loss. And why does that very spectacular bone loss occurs? Because the person who's lying on that bed has, for the past 3 months, taken away the gravitational load on their skeleton. So they've taken away the gravitational forces that are so important for the bone formation. Other studies that have shown why so important weight-bearing exercise is so important for bones are studies in astronauts, for example. And so people who would be on zero gravity for long periods of time have looked at their bones before and after space flight and look at the difference in kind of under the microscope of those cells and those bone cells before, the control cells before the flight, where you have a lot of mass, bone mass, and also you've got such a nice kind of mesh, if you want, and look at the bone cells after the space flight. They look very osteoporotic. There is less bone and there's a deteriorated microarchitecture of the lamella. And why did all of that occur? Again, because the gravitational forces have been taken away, if you want, because these people are on a space flight, and therefore there's no weight bearing on their skeleton in order to stimulate the skeleton to make more bone. Of course, you and me, we don't normally, under normal circumstances, lie in bed for uninterrupted for 12 weeks. We don't normally get ourselves a spacesuit and go up to Mars. But what do? We sit on a chair for long periods of time. I've been sitting on this chair since 9 o'clock when I started working today. And we know that just sitting on a chair or lying in a bed for long periods of uninterrupted kind of time is quite bad for your health. We also know that older adults tend to spend vast amounts of their days in these type of sedentary behaviors, about 8 to 12 hours per day of not doing much, sitting on a chair without interrupting their sitting. So the hypothesis here is that these people who are doing these type of sedentary behaviors will have worse bones than people who are more active all the day. We know that sedentary behavior overall comes with a number of health risks. So older people, lots of people over the age of 60, there's been quite a lot of research in cardiometabolic health and why sedentary behavior is bad. So we know that people who tend to sing for long periods of time have higher plasma glucose and cholesterol. That's bad news for your heart. Have a higher bone mass index and waist to hip ratio. Again, that central obesity is bad for your heart and your blood vessels. They also have reduced strength and reduced bone density. And there's also a link with musculoskeletal pain. If you're sitting a lot, there's an increased chance of getting musculoskeletal pain, and some social kind of and psychological effects as well. So reduced quality of life, reduce social inclusion and social engagement, which also has an effect on total quality of life. In more specific, there have been studies that have shown that sedentary behavior, sitting on a chair like I am just now for long periods of time has got a detrimental effect on the skeleton, especially the hip, the femur and the sub-hip regions in women, and that effect is independent of the total amount that people engage in moderate and vigorous activity. Now, this is quite important. So you could have people like me who, before COVID happened, go to the gym 3 times a week and meet the physical activity recommendations, the guidelines. And, you know, I feel good about it and give a good pat to my shoulder saying, you've done your deed, Alex, today. But when I sit in my desk for, you know, long periods of time, 4 hours in the morning and then 4 hours in the afternoon, I am negating all the goodness I've done with me going to three times a week to my gym. So it's not only important that you're physically active, but the times that you're not physically active, what are you doing? Are you sitting on a chair? And are you having long periods of time that are of inactivity? Are you breaking up your sedentary behavior? So why am I focusing on sedentary behavior so much? This is because there's more and more evidence coming out to tell us that physical inactivity is actually an independent risk factor for death worldwide, is the 4th leading cause for death worldwide. And because there's more and more evidence coming for sedentary behavior, there is now the guidelines for physical activity have also been updated to include not only physical activity, but asking people to do something about reducing their sedentary behavior as well. So sedentary behavior is quite prominent in the 2019 Chief Medical Officer Guidelines for Physical Activity in older adults. So how can you break up sedentary behavior? Well, there's 2 ways of thinking about sitting less. A, you can spend less time sitting, so a total amount, you could try and reduce your total amount. And then B, and perhaps more kind of interesting, is breaking up your periods of sitting. So making shorter sitting bouts. So this is a study here that some colleagues from Glasgow Caledonian University did over 10 weeks. They asked people who lived in sheltered, older people who lived in sheltered housing around Glasgow to just add 10 to 50 sit-to-stands a day, and assessed whether their health improved from that. So nothing too onerous, nothing too strenuous. All we did, we asked these older people to, over the 10 weeks of the study, to just break up their sedentary behavior by standing up 10 to 15 times a day. And there was an improvement in certain aspects that we measured, physical functioning aspects that we measured. So people could so they improved that at the time it took them to get up and go from a chair and rise from chairs. So there's something to be said of not only reducing the total time that you're sitting, but actually making yourself to stand up every so often when you're sitting down. Therefore, if we were doing this in a live audience, I would have asked you to stand up now all together with me. So maybe you can actually do that while you're sitting in your city at your own house just now. So that's all I wanted to say about sedentary behavior and how important it is. But I also want to talk about the other end of the spectrum, physical activity for older adults and for adults and older adults. And this is again taken from the Chief Medical Officer Physical Activity Guidelines, the latest version that we've got from 2019, where we, and I was involved in some of those guidelines, we were asked to look at all the evidence that's out there and kind of make recommendations for the nation. And we looked at the evidence as far as certain diseases is concerned. So, for example, diabetes, cardiovascular disease, I'm interested in joint and back pain, falls, and things like that. And in every single one of those kind of studies, there is a kind of a stunning effect of physical activity on health. So the health benefits are quite impressive. So the revised guidelines currently for the UK is that there you go, you've got your sedentary, minimize your sedentary time here in the corner in yellow, but we're still asking you to be active at least 150 minutes per week. But we're also telling you, you should also build your strength at least 2 days per week, and also you should improve your balance. And this is quite important, and this is kind of, if you want an add-on in the revised guidelines, the importance of building strength and improving balance are also very important for bone health. Because if you can improve your strength and your balance, you're less likely to fall. And then if you're less likely to fall, then you're less likely to break a bone. And it's never too late to start. Quite often when I give presentations, people might come up and say, well, I am 70 years old, you know, I've done the damage that I could do to my bones or to my muscles. You know, there's no point of me starting, is there? And the answer is, Yes, there is a point. It's never too late to start. Indeed, the lower the base level of physical activity, the greater the health benefit you're going to see by increasing your levels of physical activity. So there's kind of a dose response curve that you can see here in my slide on the right hand side, showing to you that the higher health benefits are those would come to those who are most sedentary. For example, there was a 12-week high-intensity strength training that was done on very, very older people, people over the age of 90 years old, and that doubled the strength. That is a huge improvement that you can have if you are in your 90s and you want to still enjoy life and you want to be able to go out and about, you want to still be able to play with your grandchildren, for example. So activities that they are progressive resistant training based could improve your strength and function and reduce your pain. It's just a matter of motivating people to engage with these type of activities rather than sit on a sofa and watch Coronation Street. As I said before, not all of us are at the same place, at the same starting point. So you can't ask people who are sedentary to go out and run for 30 minutes. It would be an impossible task. So it's a staged kind of approach. You want to get people who are very sedentary and do much to move a bit. And once they've achieved that and they're comfortable with that level, then you need to challenge them a little bit more. You need to be challenging yourselves a little bit more and move more often. And once you're comfortable with that, then you need to be moving more regularly and frequently. And then see, can I achieve the 150 minutes of moderate physical activity per week? Am I on my way to that trajectory? There's more evidence here for you who like to look at scientific evidence. So this is a Cochrane review quite a few years ago now, but looked at all the randomized controlled trials, 43 by that time, that had a lot of participants who were asked to do different type of exercises and looked at bone health outcomes. So there was, and when we put all that evidence together, we could see, or Tracy Howe could see, a small but significant improvement in bone mineral density at different sites in the body, at your spine, your total hip, and the trochanter, which is an area within your hip. And they looked at different types of exercises because different kind of studies have employed different types of physical activity. So combination exercise and exercise where you have both aerobic and resistance type of exercise had an effect on your trochanter and your spine and on the number of total fractures. Things that add weight-bearing type of activities like jogging and jumping, things that add impact on your bones were effective on your hip or on the total hip bone mineral density. Strength training, where you have high loads, strength training would be using a dumbbell, for example, and low repetitions had an effect on the spine. Even simple things like single leg standing, which you can do at your own home, holding, a chair or on the counter and stand on a single leg, or when you're brushing your teeth, for example, were effective on the bone mineral density of the hip. There was no significant reduction in fractures overall, and the other interesting thing that this review found that people who were confident to do more physical activity, all the people who were more confident to do physical activity and engage in these kind of exercises were more likely to have a fall, but not a fracture. Perhaps what's more kind of interesting when it is more interesting when we look at the evidence that backs up the effect of physical activity on bone health is the effect of physical activity has on falls prevention. Because I've said this before, the aim of any of these kind of interventions is to prevent people from falling down and breaking a hip. So if you can prevent the fall, then you're preventing the fracture as well. So this is kind of a combination of studies here. So if you look at all the exercise studies that have happened, about 17% reduction in falls is evident, and the greatest reduction, about 40%, which is quite a big number of reduction of falls, occurs when you have exercise programs that they will challenge your balance, that they will be quite high in dosage, over 50 hours, that they will progressively challenge you more. So you start with your baseline, but then you start challenging yourself a little bit more and a little bit more. Walking programs don't seem to have an effect on falls prevention, and the most effective programs were those who were using actually trained instructors. The fear of falling reduced in all of these kind of exercise programs as well, and that's important. As I noted at the beginning, fear of falling is one of the major things that holds people back after they had a broken bone, come back to normality and being physically active. So these falls prevention exercise programs increase the confidence that you have in yourself, and therefore reduce the fear of falling out. Having and fracturing again. I did mention earlier on that walking did not have an effect on preventing falls. Indeed, walking has many benefits, and I do want you to go out and enjoy your walk with your dog, with your grandchildren, but generally speaking, it does not improve strength or your power or your bone mineral density, unless you are doing a very brisk, out of breath kind of walking with added weight, perhaps. The benefits of walking are more cardiovascular based rather than power and strength and or related to bone health. I'm sure I'm going to have lots of questions about this at the end about walking, but that's absolutely fine. So I'd like to spend the last few minutes of this webinar telling you about what's available for you during this time that we're in, when you can't go to your normal Tai Chi class that you would have normally be going, you can't go to the gym, you can't go to the swimming pool. What on earth can you do so that you don't let your muscle strength and your bone strength deteriorate? This is a rapid review from colleagues down at Manchester Uni, where they looked at all that's available up until May. This was published last month. All that was available during the COVID crisis in the UK for older adults, and looked at the science behind what was available. So they didn't look at Joe Blogs who might decide to do a wee podcast and they think they know how to prescribe exercises for older adults. So they looked at evidence-based exercise programs. So they looked at websites, and there's 3 websites there that there's good demonstrations with good evidence-based exercise programs. They looked at certain mobile apps that might be available for you to download for free, and there's advice there on exercises that older people should be doing in order to improve their strength and balance and coordination, and therefore reduce the risk of falling and risk of fractures. And there's also exercise people that they're aimed at older people, exercise videos that they might be available on Facebook or YouTube. But there's so many of those out there that you need to be careful of the source that you get. It needs to be from a credible source and people that they know what they're talking about. There's a couple that I've noted there. Indeed, I wonder whether I would show you one of this. This is a screenshot from last night from one of the videos that exist. I'm streaming it from Facebook, but it's also available on YouTube. This is the later life training and this is their Make Movement Your Mission, that has about 40,000 people on it, I think, kind of looking and following these postural stability instructors where they're trying to get older people to move. So the guys are doing that 3 times. There's 3 exercise snacks per every day, and it started on day 1 of lockdown, but it's going on up until it's still going on, and you can tune in and you can do the exercises with the trainer. So I think they do them 8 o'clock in the morning, 12 o'clock at lunchtime, and I want to say 4 o'clock in the afternoon, but don't quote me on the 4 o'clock. But there's 3 throughout the day live, and you follow them and do the same exercises in your home kitchen or in your garden. The other place that I would suggest you have a good look at is some more exercise videos from the Royal Osteoporosis Society. From the Royal Osteoporosis Society, they've put some videos out there that they're safe and evidence-based for people with osteoporosis. So have a look, some very good resources there from the Royal Osteoporosis Society, and the web page is on the bottom of my slide. I'd like to kind of come to an end and finish this presentation by saying to you that it's never too late to start exercising. You're never too old. Pain is never a good thing, but if you have done enough, then your muscles must have this little discomfort that we get after exercise. And we need strong muscles for maintaining our independence, for caring for someone and playing with the grandchildren, for fighting infection and staying warm, for protecting our joints and our bones and our brains and our memory. So strong muscles, good health is very important for being able to have a good quality of life in the older years. Taking regular breaks from sitting is equally important as being physically active and meeting the physical activity recommendations. So think about ways that you could reduce your sedentary behavior. Put the remote control in the sofa next to you, so therefore you have to get up and get the remote control to change the channel on your TV. Things like that. Some exercise is good. Once you've achieved that, then aim for higher, because more is better. And remember, you need to use it or you're going to lose it. And that's the case for muscle strength, it's the case for muscle mass, it's the case for function. So keep moving, and most importantly, keep moving and enjoy the quality of life that comes with being independent and being able to do the things that you enjoy to do. And that's it for me. I hope you enjoyed it. I am more than happy for Gemma to come in just now. I think she's coming in.
Hi there, yeah, I'm here. Thank you very much, Alexandra.
And then we can both look at questions. Let me just end the show and get here. My Zoom meeting. If I can do it. Why can I not see my Zoom meeting? Sorry, these are my kids. Now people can see. Stop sharing. That's great. I've done.
Okay, excellent. Thank you so much. No, that was really, really interesting. So I think what we'll do is I think we've already got a question come through.
Yes. So something about diet. So I can speak to you about diet for a long period of time. I'm a dietitian by profession. Right here. So the question was, you know, what diet? So there's a few things that you can do as far as diet is concerned to have for healthy bones. The obvious things are enough calcium in your diet, 800 milligrams per day. Enough vitamin D in your diet, and on beautiful days like this, enough vitamin D from the sun. So go out and about for a walk, expose your arms and your face so that you can make vitamin D, and making sure that you get enough protein in your diet. Protein is important for bones as well. And I know it sounds boring, but overall speaking, a healthy, balanced diet is the basis for health overall and bone health indeed. Would that answer your question? I hope so.
Okay, so I think there's a few more coming.
I talked about osteoporosis. What I said about osteoporosis, does it apply to osteoarthritis? Obviously, these two diseases are distinct. These conditions are different. Osteoporosis is a disease of fragile bones. Osteoarthritis is a disease, if you're a condition of painful joints. Overall speaking, I would have to say both for any type of arthritis, both osteoarthritis and rheumatoid arthritis, the more you do physically, as far as physical activity is concerned, the better you are. And indeed, there have been quite a lot of studies that show that if you increase your physical activity levels, you reduce the pain that is associated with osteoarthritis. So yes, as a general gist, what I said about osteoporosis applies to osteoarthritis, but things like weight-bearing exercise is not so important for osteoarthritis as it would be for osteoporosis. So for osteoarthritis, it would be more the general physical activity rather than the more bone-loading physical activity that is important for osteoporosis. How important is HRT for reducing osteoporosis? So HRT, for those who don't know, is hormone replacement therapy. It's given to some younger, older adults, mainly people who, women who would have had an early menopause. And so it has a very strong effect on bone. However, it also comes with certain side effects. So increased, for example, myocardial infarction, if it continues for very long periods of time. So I would suggest that this is probably a question you want to ask your GP or your clinician who's looking after you. But the evidence is that yes, HRT has a favorable effect on bone, but it comes with certain side effects. So these need to be balanced when you're looking at, and from a clinician who's looking at your health, overall, your overall health, and kind of strike a balance there. Does taking 2 calcium tablets a day provide sufficient calcium along with hyaluronic acid? On steroids, but keep forgetting to take a second dose daily. Okay, so this lady obviously has osteoporosis and is taking a bisphosphonate. The hyaluronic acid is for her osteoporosis, and every person who's subscribed a bisphosphonate will also be subscribed a calcium and vitamin D tablet. Why? Because all the studies that we have on bisphosphonates were done, all the randomized control trials we've got were given to people with calcium and vitamin D. So the answer is, I don't know. I don't know how much calcium you have in your diet, because if you have a fair amount of calcium in your diet, possibly 1 tablet of calcium would be okay for you. But if your diet is very poor on calcium, then you definitely need the 2 tablets of calcium per day. As far as forgetting to take your calcium, I am with you. I forget to do lots of things as well. And I would suggest that you put a wee reminder on your phone, and that would help with kind of reminding you what you need to do. Alcohol misuse and decrease bone mineral density. Yes. So I don't know. So yes, so there is an association. So there is an association between high alcohol intake and lower bone mineral density. Indeed, it's one of the main reasons why men in the Glasgow area present to their GPs or to their rheumatology departments with osteoporosis. Okay, so high levels of alcohol are associated with lower levels of bone mineral density, especially in men. But I don't know what else the perhaps what else you would like me. Sorry, I don't have osteoporosis. This is preventative because I have rheumatoid arthritis. Okay, fair enough. Okay, so you're taking, it's all right, because, all right, okay. Fair enough. Okay, so you are on certain medications in order to prevent things because you have a different disease. Fair enough. Sorry. See, this is the problem when you're actually answering questions by reading a question rather than, you know, when you're in a real life situation where you actually have the person in front of you. Apologies for that.
Okay, great. Well, I think that's all the questions for now, unless we have any more last minute. But again, thank you very much, Alexandra, for doing that for us today. It was really interesting. Thank you for answering all those questions. I hope you've all enjoyed it today. If you have any feedback from the lecture, please do get in touch. You can just reply to the message where you were given the link for today, and I can certainly pass that on to Alexandra. Or if you have any feedback for us at CLL, anything you'd like to hear about more, any sort of topics that we could look at for future lectures. We do have another one scheduled in for early September with political scientist John Curtis from the School of Government and Public Policy, so that'll be an interesting one.
Definitely.
A lot of you can join us for that as well, but look out for more information on that in the next CLL newsletter that'll come out over the summer. So, oh, I think there might be, oh, it's just, I was going to say a number more questions. Somebody just said, great presentation, thank you very much. So that's lovely notes to end on. So thank you very much, and thank you all for joining us today, and we'll see you again soon.
Thank you, and
thank you again.
Take care. Bye.
Bye. Bye.